You need to hear what happened to the Eric Sack family in Maine, as reported in their local newspaper. Sack said his daughter brought home some pills in an unmarked baggie that she said were Zoloft that she'd received from the federally funded school-based health center inside her high school. Concerned that his minor daughter had received a prescription antidepressant without his knowledge or consent, Sack called the school, and the health center told him they were legally allowed to give his daughter prescription drugs without informing him, and they wouldn't talk about the lack of a label or safety container. So he pulled his daughter out of school until he could have her seen by a doctor of his choosing, not through the school. That triggered a call from a Child Protective Services agent to Sack, informing him that he would be arriving shortly to make a surprise visit to his home, and that it was, quote, an emergency situation, that I was pretty near holding my daughter hostage, according to Sack. For 3 hours, the agent grilled him and his family individually and as a group, including questions about his firearms and where he keeps them. Eventually, the agent, quote, indicated that the complaint against him appeared to be unfounded, close quote. In a case at another Maine school, another mother was investigated by CPS after complaining that a social worker at her 13-year-old daughter's school had begun counseling her without parental knowledge on gender transition and provided her with breast binders, and school employees had begun using masculine pronouns to refer to the girl. Do you know what a school-based health center is? Do you know if your kid's school uses one? There are over 3,000 of them in the U.S. School-based health clinics are federally funded and intended to be your kid's primary care practitioner. If there's one in the school that your minor children attend, you might want to check the bundle of back-to-school forms you signed. You may have signed a form that you thought just gave authorization for emergency care when you actually gave your approval for a wide range of medical care, including routine pediatric care like immunizations, mental health and behavioral health services, including gender counseling and prescription medication, reproductive counseling, including hormonal birth control prescriptions, pregnancy-related care, sexually transmitted disease treatment, substance abuse interventions, dental and vision care, all without the school clinic even advising you, let alone getting your permission. I am a huge advocate of parental rights, especially around healthcare, social counseling, and education of our children. And that's what this post is about. It's not a statement of agreement or disagreement with gender transitioning. That's a very different and very deep subject. And precisely because it's so deep and life-altering, decisions around that belong squarely within the family circle with invited advisors. Any attempt to treat our children medically or decide education curricula without our consent in each and every individual occurrence should be vigorously fought against. This is a very slippery slope. Find out your school's policy on what things require parental consent and notification. You might be surprised. And anything you've authorized, you can revoke.